Welcome to Public Health Unfiltered by Endas, the podcast where we have real conversations, real issues, no filters. I am Michaela Drake, your host, and our mission is simple: breaking stigma through real talk. Here, we talk about public health, education, and the real issues affecting our communities and our world. Bringing in experts, sharing stories, and creating safe space for dialogue. Whether it's mental health, social stigma, or community wellness, this podcast is about understanding, empowering, and taking action, because public health isn't just about policies, it's about people. So tune in, join the conversation, and let's get real. Welcome back to episode 2, and we're talking about why public health matters. A lot of people do not think about public health until something goes wrong, but it's always working in the background. Public health affects how communities are educated, how health information is shared, and how people respond to issues like mental health or disease. Public health is about prevention, not just reaction. And when public health is strong, communities are stronger, healthier, and more informed. That's why conversations and education are so important, because awareness leads to better outcomes. Section Topic 1: Prevention is key. Public health is all about prevention. Instead of waiting for illness to occur, public health systems identify risks and implement programs to reduce those risks. Vaccination campaigns prevent disease outbreaks. Nutrition and exercise programs reduce chronic illnesses like diabetes or heart disease. Mental health awareness campaigns prevent crises and support well-being. Prevention saves lives and money. By keeping communities healthy, we reduce the burden on hospitals, families, and society. So if we can get the prevention and give free measures and education materials and resources, then we are more likely to reduce the actual disease, illness, or outbreaks. Next, we're going to talk about awareness and education. Awareness is the foundation, the central platform to public health. People need to know how diseases spread, how to prevent illness, and how to make healthier lifestyle choices. Public health also teach healthy behaviors, from safe food practice to proper sanitation. Knowledge empowers communities to take control of their health and take action. Next, we're going to talk about healthy communities and global health. Public health isn't just about individuals, it's about communities and populations. Safe populations, clean water, proper sanitation, safe neighborhoods protect everyone. Global health, infectious diseases do not respect borders, so public health helps contain outbreaks worldwide. Community health initiatives also addresses inequalities, ensuring everyone has access to care, resources, and education. Our role, your role, everyone's role. Even if you're not a public health professional, you can take part by getting vaccinated, staying educated, resources, research, educate your family and community, support healthy behaviors, advocate for policies that protect public health. Every action counts towards building a safer, healthier community. And this is very important when we're talking about public health. Those in the previous episode, we talked and discussed different roles that public health experts have, but you are also an expert of your own health in your own lives. So why not take the information that you learned and the things that you have lived and share those things and educate your community, especially if it's the right information. Ending stigma, addressing barriers and inequalities. You have a voice, you have a right, and your healthcare is your right, and your voice is your power to talk up and talk about the things that is going on in your community, in your world, in your state, in your nation, and in your country, and in your continent. To foster a safe and healthier community and a healthier environment. Your role also matters because there are many healthcare professionals, but who does not know their health better than the patient? So when we're talking about educating your community and your family, you are a trusted voice and a trusted healer where you're located, and you must talk up. For example, I live in the States, so my voice may not have that much power as in somebody who's in public health in Europe versus somebody's in Asia. That is not my culture. I do not have any life experience to talk about their issues, but what I do have is research to give it to the people in the community, and they take it and educate it in their way, in their culture, that will bring a impactful impact. Another example, being in the southern states, I do not have the experience or the connections to talk about issues that are going on up north, nor do they understand our culture. Our culture down here is fried food, fried everything. So going up north where they might not have the sweetest tea versus we have sugar diabetes down here, we have to give that information to the people up north, whatever issues that they're having, to educate them. And they are the people that put out the information versus somebody up north who's trying to get us to stop putting all the sugar in our tea. We might not understand or be able to relate to that person. And relations and relationship is a very key component in public health, and we want the person that's giving the information to be relatable. So you also have to be vulnerable, talk to the patient or the persons on their level. And also, as you just heard me slip up and say patient, they're not a patient when you're educating them. They're just an individual that is eager to know more healthcare information. And it is our job to educate them to the best of our abilities. And if we do not know an answer, we can always say, let me get you in connection with someone who does, or let me research this and get myself familiar about talking to that person, especially if you're a key pillar in your community. You might want to research or reach out to a public health professional or research the topic and dive deep into it, not only to better educate yourself, but be able to relate that information back to the community. Also, it matters with debunking stigma, debunking misinformation from the media outlets to what you see on social media, the news, from people who want to have a voice, influencers. We also have to be careful about who we are connecting to and who we're allowing to put out information, especially if they're not getting it from a trusted source. We use .gov, we use information such as medical professional sites. We do not just use Wikipedia. We do not, that is not a trusted source. We get most of our information from academia's academia sites such as schools or public sites that is trusted, like NIH. There are several platforms that are trusted. as to why this work matters. This work is very important in taking action and meeting people where they are. And tomorrow we're going to dive deeper into stigma in public health, what it looks like, how does it harm communities, and why addressing it is so important. For tuning in to Public Health Unfiltered by Endas. I hope today's conversation gave you insight, challenged your perspective, or inspired action. Remember, our mission is breaking stigma through real talk. And that starts with each of us having honest conversation, staying informed, and supporting our communities. If you enjoyed today's episode, make sure to subscribe, leave a review, and share it with someone who should hear this message. And do not forget to join the conversation on social media. Let us know what topics you want us to cover next. And let's keep taking.